Hello students, myself Dr. Maddineni Srinivas. Welcome back to my YouTube channel. So in this video we are going to cover DRUS syndrome, and I hope you all know that already I have covered many dermatology related topics which are important for the theory examinations of final prof. So in this video we are going to cover the DRUS syndrome, which is going to stand for drug reaction with eosinophilia and systemic symptoms. So DRESS stands for drug reaction or drug rash with eosinophilia and systemic symptoms. So there will be multiple organ involvement, so we can say systemic symptoms. This is a full form. So if you can remember just what is a full form, then you can understand what are all the important headings related to DRUS syndrome. So what is the etiology? So it is a drug rash, so there will be a history of medications like anticonvulsants, sulfonamides, antibiotics, so minocycline, vancomycin, and also remember there can be a viral cause. HHV6, human herpes virus 6, can also be one of the etiological agents which can produce the clinical features, in which you have to remember that the patients can have fever, and of course rash will be there. I will show you how the rash will be. An important point which you have to write is facial edema, and there will be lymphadenopathy which can occur, eosinophilia, of course in the labs we can see this, and atypical lymphocytosis. And the patients can have multiple organ involvement. There can be hepatitis, nephritis, and pneumonitis. All these are important for you to write in the examination. So here is the actual patient who is having this facial edema. You are able to see the facial edema, and all over the body also you are able to see that there is a redness, and there can be papular lesions, and there can be purpuric lesions everywhere over the body, and even you can see the lips are also affected. Okay, so I hope this video was helpful. If it was helpful, please do hit that like button. Okay, and coming to the management, what is an important thing to say? Stop the drug which is producing this reaction, and systemic corticosteroids can be given to reduce the inflammatory component. So prednisolone is the systemic corticosteroid which we can use. And because the patients can have the multiple systems which can be affected, so multi-organ monitor should be done so that they are not going into the failure. And usually mortality can be 10%. So if 100 persons are having this DRUS syndrome, there can be 10 individuals who can die. So that's why the monitoring is very crucial. And there can patients who are surviving, they can have the chronic hepatitis and also thyroid dysfunction for lifelong. Okay, so this was about the DRUS syndrome. So to just summarize a very quick fashion, so it is a severe drug induced hypersensitivity reaction where the patients are going to have fever and a rash, and there will be eosinophilia on labs, and there will be multiple organ involvement. Then there are so many medications, anticonvulsants, allopurinol, antibiotics management. Stop the drug, systemic corticosteroids, and organ monitoring, organ function monitoring. So this is what we have to write in the theory examination if the question asks about DRUS syndrome. So I hope this video was helpful. If it was helpful, please do that like button, and also do share this among your friends and try to discuss and read, and immediately you are going to have the memory which is going to build up into long term memory if you read immediately. And in the comments write down HSV if you want me to make a video on genital herpes simplex. And thank you so much. So do subscribe to this channel if you are not yet subscribed to this channel, and all the very best for your examinations which are very close right now. So happy learning, and all the very best. Do great in the exams. We'll meet in the next video. Till then, Sarvam Sri Krishna Arpanam and Sarve Jana Sukhino Bhavantu.